So thank you everyone for joining today's briefing session. We have a team of 6 of us from CHN here today. I'll run through everyone, but I'll introduce myself first. So my name is Steph. I am the Mental Health and Suicide Prevention Program Manager at Capital Health Network. I'll pass over to Emma first to introduce herself.
Thanks very much, Steph. My name's Emma Hall. I am the Mental Health Project Officer at Capital Health Network. I am also the current project manager for the Tuggeranong Medicare Mental Health Centre.
Thanks, Emma. Anais?
Good morning, everyone. So my name's Anais Segal. I'm the General Manager of the Health System Improvement here at CHN.
Thanks, Anais. Mamta?
Thanks, Steph. Hi, everyone. My name is Mamta. I'm the Senior Manager for the Health System Integration team. Thank you.
Thanks, Mamta. Sharon?
Good morning, everyone. The Procurement and Contracts Coordinator here at CHN, working with the team to progress this procurement.
Thanks, Sharon. And Tanya?
Hi, so I'm Tanya Sirius. I'm the Initial Assessment and Referral Training and Support Officer here at CHN.
Wonderful. Thank you, CHN team. So we'll all be here to answer any questions that you might have while we go through the briefing session. But I'm just going to begin by giving you a little bit of an overview about what we're going to talk about today, just the sort of process for today's briefing session and a bit of housekeeping. So we have started the recording. This briefing session will be recorded and will go up on the CHN website for you to view afterwards if you want to check anything that we talked about, and also for anyone who wasn't able to attend today's briefing session. For the recording, this will only be recording the CHN team, but we will be reading out any questions that you do ask as well. So the way that today will work is I will start by giving us a little bit of an overview of Capital Health Network and the Medicare mental health centres and the model sort of at a national level. I'm then going to pass over to Emma, who's the project manager for the Tuggeranong Medicare Mental Health Centre, and she will take you through this particular project and the request for proposal purposes. So she will be going through the real process and timelines and how we're sort of approaching this particular procurement process. After Emma's finished with that, we will then be going on to questions. You are absolutely welcome to post questions at any point. Don't have to wait until the end, but we will be asking them and answering them at the end. When you do post questions, please put them only in the Q&A box. So the Q&A is if you look at the toolbar at the bottom of your screen on Zoom, it is the second one along next to participants, and it's got 2 little speech bubbles in it. So please make sure that you put it in that one and not the chat. The chat is really for any sort of tech issues or anything like that. Tanya will be monitoring that as our tech support for today. So please don't put your questions for us to be answering there, as it's much more difficult for us to keep track of those and make sure that we actually are able to answer your questions. I think that's everything for the sort of process and everything. So I might move on, and we'll just start by giving a little bit of an overview about Capital Health Network. So for those who aren't familiar with CHN, we are the primary health network for the ACT. So primary health networks have been established by the Australian government. There's 31 primary health networks across Australia, and our role is really in increasing the efficiency and effectiveness of health services for patients, particularly those at risk of poor health outcomes, and improving coordination of care to ensure that patients receive the right care in the right place at the right time. So as a PHN, we commission health services, we work with primary care, and we do all of this work with that sort of key objective of being able to improve that sort of coordination and efficiency and effectiveness, and really ensure that people are able to access appropriate support for their needs. So CHN does have a series of priority areas as well. So we've got 9 priority areas, which you can see on the right-hand side of the screen there. A lot of our initiatives do sit across multiple priority areas. Today, we are, of course, talking largely about mental health, but I think that it is important to acknowledge that when we are talking about the Medicare Mental Health Centre program, we are addressing most of those priority areas as well. Okay, so Medicare Mental Health Centres are a national model that was first commenced in Australia in 2021. So Medicare Mental Health Centres are designed to address fragmentation in the mental health service system and enhance local service integration to offer a seamless care pathway, really with the idea of making sure that people do receive that right level of care at the right time to be meeting their mental health needs. So Medicare Mental Health Centres are really focused around being able to support service navigation and being able to provide appropriate care to people, particularly those who may not be able to access appropriate care in other avenues. So there are 4 core service elements that sit within the national model for Medicare Mental Health Centres. These are responding to people in significant distress, including those at heightened risk of suicide, providing a central point to connecting people to other services in the region that might be the most appropriate and particularly longer term services for their needs, providing in-house assessment, including information and support to access services, and providing evidence-based and evidence-informed immediate support, as well as short to medium-term episodes of care that can support people within Medicare mental health services who cannot be better supported by other services within their region for a variety of reasons. Another important consideration when talking about Medicare mental health centres is they do link with the National Head to Health phone service to enable consumers to access care in their region. So the National Head to Health phone service, many of you will be aware of it. They are commissioned by PHNs. They are a national service, but they all have local providers to make sure that the phone services are able to connect people to the best local services. And importantly, they do provide intake into Medicare mental health centres as well. So while they do provide service navigation, and the real goal is to make sure that people are able to access services regardless of what the right services are to meet their needs, they are also providing that direct intake function. So one note about Medicare Mental Health Centres before I pass over to Emma to talk about the Tuggeranong Medicare Mental Health Centre specifically is that this is a rename of Head to Health Centres. So many of you will be aware of Head to Health Centres, and as part of the 2024 federal budget, the Australian government did announce that all Head to Health adult mental health centres will be renamed to Medicare Mental Health Centres. The aim of this was to better align these services with trusted clinical services provided by the Australian government under that trust of the Medicare name. This does involve a rebrand of the existing Medicare Mental Health Centre that we have in Canberra, as well as all upcoming Medicare Mental Health Centres. So you may have heard CHN previously refer to Tuggeranong Head to Health in some previous communications and our initial media release about this service. So that will be now referred to as the Tuggeranong Medicare Mental Health Centre, which that branding will be in place by November of this year. So this will not be having major impacts on the RFP or on what the successful provider for this tender will have to do. And Emma's about to go into a little bit more detail about that. But we just wanted to be very clear about what we are talking about here in terms of Head to Health and Medicare Mental Health Centres. If you do have any questions about that as well, we're very happy to answer them, as we do appreciate this is quite new and it may cause some confusion. So very happy to support with that. I'm going to pass over to Emma now, and she will be going to a bit more detail about the Tuggeranong Medicare Mental Health Centre and then taking us through the process for this RFP.
Fantastic. Thank you very much, Steph. Yes, certainly, I think it's good to reiterate the sort of main message that I think we're trying to communicate with this slide is that we do understand that this is a big change, and the new branding is expected to be finalised by November 2024, and we are here sort of the entire time, and we'll be here working with the successful lead agency to navigate service establishment while that's underway. So it certainly won't be a process having to be navigated individually. Key, I think, again, to what we are about to move on to in terms of the RFP itself, the rebranding will not be changing any key elements of the national service model. So nothing is inherently different than what would have been, I guess, responded to for an RFP for a Tuggeranong Head to Health Centre. And consumers, I think it's important to note, will not need to provide Medicare details or have access to Medicare to utilise the centre. So very much that element of the model of free and accessible care is staying the same. So with that message communicated as much as we can at this stage, I will move on to talking a little bit more about the actual RFP. Excellent. So our procurement activity 111 is for our Tuggeranong Medicare Mental Health Centre. So this request for proposal is seeking a lead agency to establish and deliver the Tuggeranong Medicare Mental Health Centre. The successful lead agency will be required to provide the 4 core service elements that were outlined in that slide earlier, as well as some additional service needs that have been outlined by CHN. And I encourage you to have a look at the RFP for more details on each of those. At Tuggeranong, including Tuggeranong Medicare Mental Health Centre must align with the Canberra Medicare Mental Health Centre, which is formerly known as Canberra Head to Health, including elements sort of that may be looked at, including referrals, programs, potentially sharing system understanding, and the phone service, which is currently operated by Think Mental Health, who currently also operate the Canberra Medicare Mental Health Centre. I think it's important to note that for this element, we are not necessarily prescribing any specific integration or alignment activities. There's an element of that you will see in the RFP response criteria. Those elements will be worked on with the successful lead agency, so it will be a collaborative development process once we get to that point. The successful lead agency will be aiming to commence service delivery in some form by the end of 2024. And funding for this program is provided by the Department of Health and Aged Care and is available at this stage until the 30th of June 2026. So some brief outcomes, these may be reasonably familiar to those of you who have experience with sort of the Head to Health national model, as it's sort of still being referred to, and Tuggeranong Medicare Mental Health Centre, the RFP. So the first is that Tuggeranong Medicare Mental Health Centre, is recognised by the health sector and the community as an accessible entry point into the mental health system. We're focusing on strong linkages between mental health services, supporting people to access services and supports that meet their needs. Looking to sort of support people to receive integrated care when they have moderate to high needs, including addressing mental, physical health and broader needs through both in-house and referred services. Ensuring that people receiving appropriate assessment and triage using consistent and evidence-informed approaches. Short to medium episodes of care being provided to people with moderate to high needs, again, tailoring to meet their individual needs. That individuals accessing the service experience reduced psychological distress and have an improved sense of personal agency or control. And finally, a very important one, of course, is that service users feel satisfied with and supported by the services they receive from Tuggeranong Medicare Mental Health Centre. As again, you'll be able to see in the RFP, there are some initial KPIs against each of these outcomes that have been outlined. However, they are available for development with the successful lead agency and will be negotiated further in the contract negotiation stage. An important revision notice. We've made sure to change the format of this slide to really bring attention to it. We have recently been informed and we were made aware that there was a minor calculation error that was present in the original RFP. That RFP has now been updated as on the PDF version available on CHN's website. We'll be publishing a Q&A document soon that will confirm, again, this number, and we very much thank the agency responsible for bringing it to our attention. So we are here to confirm that the correct total figure is this 2,700,444.56. I believe that was previously 2,900,000. So that is the revised correction, and that has been included in the updated RFP. So just an important notice to be aware of. I'm not going to go into extreme detail in these because really the comprehensive thing to look at if you're looking for more information is the RFP itself, which contains full details on how to potentially respond to each of these questions. However, our assessment criteria that Capital Health Network are looking at for this procurement activity, as far as each section, we are looking at the local service model, responsive practice. So this is a broad term, but roughly includes sort of strengths-based, inclusive, and culturally safe practice in Tuggeranong Medicare Mental Health Centre. System integration and relationships. Experience, including experience in the provision of mental health support to adults. Governance structure and systems. Recruitment, including a proposed staffing profile. And value for money as a service. I would like to intentionally draw your attention to the additional requirement listed there at the bottom, which is the budget. CHN are taking a new approach to this particular RFP, and we are not scoring the budget specifically. We would like one to be provided, and that particular budget will be taken into account in scorings of the other assessment criteria, where it may be relevant to what's detailed in those. However, it is not being independently scored as part of the assessment process. There are also some additional assurance and compliance requirements that may apply. So please, again, have a look at the RFP itself for further details. So there are a few additional pieces of information that I recommend having a close look at to support your application. So initially, there is the service model for Head to Health adult mental health centres and satellites. You'll know that this is still using the Head to Health branding. We have received some guidance from the Commonwealth that this will be updated soon as part of the overall rebrand towards the Medicare Mental Health Centre model. However, this is sort of the current accurate title of the document, so that is available. These are all available linked on the CHN website. So that does detail just the broad service model and the intent for the adult mental health centres. The second is the national PHN guidance around the initial assessment and referral for mental health care. This details the, I guess, background and principles behind the IAR assessment tool, including, I think, some broad descriptions of its categories. These are often used, sort of widely used in Medicare mental health centres, and would be worth taking a look at for those who are unfamiliar. The third is a fact sheet about Medicare mental health centres. This is a fact sheet from the Commonwealth Department of Health and Aged Care, providing a little bit more information about the upcoming rebrand that may provide some answers to a few questions if anyone has any about that particular change in name. And finally, what we have is our Q&A, which is not currently available on the website, but we are hoping to have uploaded by the end of the week with some answers to a few questions, including we are, time permitting, we are hoping to have any questions from today included in that document. So they will be available for all any applicants or anyone visiting the website to see. So finally, and probably most important, a brief reminder about some key dates that are worth remembering. The end of period for questions or requests for information is next Thursday, the 18th of July at 5 p.m, so close of business that day. And we are hoping to have, again, an updated Q&A with any final questions at that point uploaded in the day or two after that. Finally, the submissions for the RFP close at 5 p.m. on Friday, the 26th of the 7th, 2024. That is a hard deadline. We unfortunately are not able to accept any applications submitted after that point. So please be sure to mark it in your calendars if needed. There are some additional submission requirements, so please take a more in-depth look at the RFP for those again. All right. Having covered most of the information about the RFP, we have gotten to the much more exciting Q&A part of the briefing. So I will pass over to the Q&A section of this Zoom webinar is open, and we encourage you to place any questions in there that you might have. We will give it a couple of minutes for them to start coming in. And if you do have any further questions after this session, or questions that you feel you don't want to raise here, and as they may be specific to your organisation or your needs, please feel free to contact the tenders email again by apologies, that is an updated date, but it is Thursday the 18th. I will pass back to Steph for the moment.
Thanks, Emma. As Emma mentioned, we'll give it a couple of minutes to see if some questions are coming through before we get started. So we'll do that now. Thank you. Okay, we have a couple of questions about the site, noting that the documentation did mention a preferred site in Tuggeranong that has already been selected. I'm going to pass those questions over to Emma. The questions are really about whether the site in Tuggeranong is set in stone and if there is any information that we can provide about that site.
Oh, thanks very much, Steph. Yes, so eagle-eyed among you will have noticed that in the RFP, we are not asking for an establishment section of the budget, as we do already have a site identified in the Tuggeranong region. The Tuggeranong region was, I think, reviewed through our sort of needs assessment process as potentially needing additional mental health support in the region. And as such, we sort of underwent a search process looking for a potential premises much earlier this year. At this stage, we have identified a premises that meets a number of the criteria that I think we were sort of looking for a potential site, including easy access to public transport, a reasonably visible location that be viable for branding and signage, as well as sort of being really reasonably central and in sort of close proximity to other health, mental health, and community services. At this stage, we're not able to provide any specific information on where exactly that site is, as at this stage, we're still in the exploration and negotiation process for that. The site is at this stage, about as far as it being set in stone, it is reasonably set, unless something goes a little bit awry, but we're certainly hoping that doesn't happen. It is largely set in stone. It is in the Tuggeranong central area, the sort of town centre in Greenway, so if that helps to narrow it down at all. As far as any more information, it is approximately about 250 to 300 meters squared. Again, that's still part of the ongoing negotiation. So we encourage you to sort of use whatever information you need about real estate and property in the region to make a rough estimate for where that might be. However, we're not going to nitpick that section of the budget, as we understand that any rent costings may be very much estimates based on that. So please don't feel any need to get that exactly right. At the end of the day, that part of the budget, how we operate the service out of that physical site and what rent looks like will be a longer negotiation process with the successful lead agency. Unfortunately, I think it's probably also important to mention that we can't provide any sort of regular updates or information on where that process is at, just due to the fact that there are sort of changes happening in the negotiation process. So hopefully that answers the question. That is about the most we can provide. However, certainly from a sort of qualitative aspect, it looks like a really viable site and we're very excited about it here at CHN.
Thanks, Emma, for that response. There is a question as well, just asking to repeat where the site is. So I'll just reiterate that for those who didn't catch it. Emma said the site is in the central area of Tuggeranong in the Greenway area. So Greenway is the suburb that is the Tuggeranong town centre. So that's where it will be. Another question for Emma, is this a clinical-based service delivery model?
Look, I'll do a little bit of interpretation on that question. As far as clinical services, if what we're interpreting as, I guess, client-facing clinical mental health services, yes, by that description. However, the Head to Health National model and thus the Tuggeranong Medicare Mental Health Centre contains some reasonable variability, I think, in its scope for what's likely to be appropriate for the region and its consumers. So certainly, I think as a widespread kind of example, many Medicare mental health centres do employ psychologists and other mental health professionals in that clinical aspect. However, there's certainly scope for, I think, addressing potential distinct population needs through the provision of other types of care and services. At the end of the day, we are looking at mental health and looking at supporting that as best we can, but we recognise that there are many ways to do that. So I encourage you to have a closer look at the national service model that's available on the CHN website, and that is something that could be potentially be addressed in the service model section of the application criteria. Again, hopefully that answers that question appropriately.
Wonderful. Another one for Emma. I think Emma's going to have a lot of these questions as our project manager. Is there an idea of numbers that would be expected to be serviced in the Tuggeranong area?
That's a really great question. At this stage, we don't have a particular ballpark of numbers. No particular KPI expectations of numbers that are expected to be serviced. There's an element of that that is likely to depend on the proposed and ultimately established service model by the lead agency. There's certainly some room for, again, flexibility based on what a service is delivering. So I can't provide any specific numbers. However, I think it would sort of be worth considering, I guess, the population of the region, the increased mental health needs that and socioeconomic determinants of mental health that are seen in the region. And we do know that there are at this stage a lack of other publicly accessible mental health services. So again, maybe something to consider in an application, but as far as a specific target, we don't have anything at this stage, and that will be explored further, again, with the successful lead agency in contract negotiation when we have some time to dive further into key performance indicators.
We also have a question about if there is a prescribed template or format for the budget. I'll give Emma's voice a little bit of a break and answer that one. CHN doesn't typically provide a template for the budget. We're very happy for organisations to provide the budget in any format that they prefer. Really, the most important thing is that it is an itemised budget. So just please, take the time to break down the budget so that we can understand really where you are dedicating those funds to. But that can be done in whichever template you prefer. We'll just take another couple of minutes break while we wait and see if there are any more questions coming through. Okay, we have a question for Emma. What is the typical organisation structure and service profile for the lead agency?
Thank you, Steph. Another great question, actually. I'll break this down into two parts as I think they are separate answers for them both. As far as a service profile, that is there are, again, two parts to the answer. I would encourage you to have a look at the National Head to Health Service Model. There are some delineations in there about distinctions between traditionally what were referred to as head to health centres versus head to health satellites. This funding is for a head to health satellite, which is a smaller service, not necessarily expected to handle the sort of similar clinical volume that a centre might be. So there are some distinctions there in the, I guess, volume and types of services that it may be expected to provide, as well as the staffing breakdown as a result. So I would encourage having a look at that. And as far as service profile more broadly, that may be up to any applicants to propose. We are asking for you to propose a particular service model. If there's a certain way that you think you may be able to provide a unique solution to mental health challenges in the region, or provide a particularly innovative model, we're certainly happy to hear it. So that service profile, I can't provide any specific direction on, as it may vary significantly based on what you are proposing to provide as part of the Tuggeranong Medicare Mental Health Centre. In terms of typical organisation structure, we are not necessarily requiring any, and as far as nationally, I can't speak as to a typicality or an average of organisations managing Medicare mental health centres. What we are looking for is appropriate governance to be able to support the Tuggeranong Medicare Mental Health Centre to ensure that our clients are safe, that they're getting the best services and having their needs supported, and that any risks can be managed appropriately in an organisation. So whether that's a big organisation, whether that's small, it's less about the structure of the organisation and more that you have the appropriate systems in place to be able to operate the centre.
Thanks, Emma. There's also a question just sort of following up on some of the previous conversations about the premises. I'm happy to just sort of answer that one. So the question is about the previous question in terms of premises costings for the budget, and whether there is information that we can provide on the premises and how that will influence the budget that will be provided in the RFP. Just to reiterate, this is one of the reasons why we have not requested an establishment budget, and also why the service delivery budget will not be scored. While it's obviously an important consideration to take those premises costings into account, we do acknowledge that we don't actually have enough information at the moment to be able to support that to be very well informed. So we are not going to be nitpicking that, as Emma mentioned. We're not going to be we're not going to be focusing too much on how the premises costs are being used in the budget due to some of those limitations in the information that's available for that at the moment. As Emma mentioned, there is 200 to 300-ish square metres space available in the town centre in Tuggeranong. Something that might also be useful is we are exploring opportunities for co-location in that space as well. We don't have any information at the moment about what that will look like. That would not be within that 200 to 300 square metres. It would be in a different part of the same building with a different service, but that may be a consideration as well. That is about as much information as we really have at the moment, unfortunately, as there are a lot of conversations up in the air about the premises, and we really can't provide very set in stone information about it until some things have actually been decided in that space. So for that reason, we really don't expect a lot of rigorous information about premises costings in the budget, and if you are unable to provide that in the budget because of that, we understand, and we will be considering that for the rest of the budget and the potential impacts that potentially higher premises costs might have on the rest of service delivery as well. So certainly the budget that you will be providing in this RFP is very much just a guideline. It is very flexible, and it will not sort of influence your other responses in the RFP and the scores that you will be receiving in those responses by the panel. It's really just for us to sort of get an indication of how some of the service delivery elements will be considered in the RFP. So I hope that helps. I know that it's really difficult not having the full information about the premises when applying for a tender, and I do wish that we could give you more, but unfortunately we just cannot at this stage. So I hope that that's sort of enough clarity to know that that budget really is quite flexible, and we're not expecting that to be particularly clear. I have another question for Emma as well. Are there expectations for providing a service outside working hours?
Well, thanks, Steph. So initially, inherently, no. There are not necessarily any requirements that have been set out in the RFP, or at this stage we are, I guess, sort of anticipating as a baseline for providing service outside of working hours. We understand that can be very difficult to set up, particularly for a new service, and may depend significantly on staffing availability and other kind of limited operational factors. So certainly initially, no, there is no necessarily expectation for providing that service outside working hours. However, that does remain in scope for the service. So certainly that would be something that we as CHN would be very happy to see if that was something that would fit in your proposed service model. I think there's also consideration for, again, particular populations that might need additional support, or that you might identify, again, in your proposed service model as of particular interest, or something that you'd like to focus on as a priority, and whether they may benefit particularly from having services provided or available outside working hours. So I think that's, again, it's a little bit of a flexible answer, which I understand may be difficult to work with, but at this stage, again, inherently no, but certainly well within the scope of any service model.
Okay, we don't have any questions at the moment, so we'll give it another couple of minutes to see if any more are coming through. Okay, looks like that might be everything for the questions then for today. So we might close this briefing session now. As Emma's already mentioned, if you do think of any other questions after today, we are still very happy to answer them up until close of business next Thursday, the 18th of July. So please feel free to send those through to tenders@chnact.org.au, as is on the screen at the moment. And we will regularly be updating the Q&A on the CHN website as any additional questions come through. So please make sure that you're keeping an eye on that regularly to see if anything else is coming through. As Emma mentioned earlier as well, we will add all of the questions from today's Q&A onto our document and get that uploaded hopefully by the end of this week. So please keep an eye on that. Otherwise, thank you all very much for attending today's briefing session. I hope that it was helpful and hopefully we were able to answer some of your questions. Looking forward to hearing from you and reading the tender responses. So thank you very much, everyone.